Welcome to Breathe California TV. This is Terry Trumbull. I'm a volunteer. We're going to talk about your lung health. One of the problems I see with our medical system is it's all focused on treating people that have problems. And these shows basically focus on prevention and how you can take charge of your own health. So we're going to be talking with a couple of hotshot Breathe California staffers today about a variety of issues in your own community and smoking. And we'll be back in 30 seconds, so stay with us.
The different therapeutic methods that we can help our very low socioeconomic status clients who have no alternatives, no anything, and there's still about 15 different resources we got out of this that if you have no resources, no service connection, you can still get aid.
That they are connected, one encourages the other, and that the process of change from backing off from the tobacco is the same as backing off from any other addictive drug.
Everyone can benefit from this training that we just were offered today. I would not take it back.
Welcome back to Breathe California TV. We're on every Monday night at 7 p.m., channel 15 on Comcast. My guests today are Deanna Canales and Swetha Thiagarajan. With a little luck, I came somewhere close to getting the last name right, Swetha. So we appreciate you. They both work for Breathe California. Deanna, why don't you start off telling us a little bit about your background and how you ended up with Breathe California?
Yeah, so like Terry said, my name is Deanna, and I'm a health educator at Breathe California. I'm also the project coordinator for the Santa Clara Community Action Model Project, and also various other projects that I work on. I'm also working on other projects where they require my Spanish translation skills, and I'm also doing my master's in public health at San Jose State University.
So what's this rum-dum school you're going to?
San Jose State University.
I retired last year after 23 years there, so I feel perfectly good about abusing. So Swetha, you've got similar kind of horrible background?
Kind of.
You're on, talk about your background and how you got to Breathe California.
Yeah, so I'm a student from San Jose State University as well, and I was looking for a way to apply my public health knowledge from the classroom and into the San Jose community to create better health for others, especially the youth. And so I wanted to advocate for a stronger tobacco policy, which is why I joined this project, and I'm really excited to be part of it.
So what was it that got you particularly interested in tobacco?
I know it affects the youth a lot, and especially with a lot of like the smoking and like the e-cigarettes and vaping. They're really high in high schoolers and middle schoolers, and a lot of our research, we found that there were a lot of tobacco retailers near schools, and that's why I'm interested in trying to restrict that and create a stronger policy.
Well, education is the solution to a lot of problems, and I can't do enough praising of you for your involvement in that. It may be extending the lives of people that pay attention by 20 years. Tobacco is a great way to limit your life, but maybe you'll talk more about that. So both of you want to maybe explain what this Emerging Community Leaders Program is?
Yeah.
Either one of you.
Yeah, I can explain it. So, as an emerging community leader, we are trained to be community activists that work within our own communities to improve the public health. And we have completed hours of training on diagnosing the community problems and conducting needs assessment and doing original research to determine the scope of the problem and learn what the community residents want to do about it. We also develop outreach and presentation skills. We learn how to deliver public testimony, and we also use social media to kind of gain attention to our issue.
So Deanna, you and I and Swetha are well aware of what Breathe California does. It's the lung health organization for the state, but what does that actually mean they're doing?
So it means we're doing a lot of good things. So we do a lot of, we work with the community in San Jose to really promote lung health, which is through our various programs, like our CPAP program, or doing what we're doing right now for the Tobacco Advocacy Project. And it's just like really great stuff. And also I can't believe that like it started 110 years ago in San Jose. So yeah, I really like Breathe California is the leader. It's the leader in lung health. So I'm really happy to be working for Breathe or at Breathe. So yeah.
Well, it's very impressive, as you suggest. My recollection is 110 years ago, it was the Tuberculosis Society, because that was such a severe problem in our society. And after we've gotten a pretty good handle on that, we switched to more of an overall focus on lungs. And it's not like you're without things to do, not the least of which is COVID-19. So tell us a little bit about what your teams are doing within Breathe California.
Yeah, so we were awarded a 2-year grant by the Santa Clara County Department of Public Health, especially in the tobacco-free communities section. And this grant has allowed us to do research in our communities, especially in San Jose. We really wanted to focus in District 3 and 5 of San Jose, just because of prior research has shown that there's a lot of tobacco retailers in this area that are close to our youth. And so we started this project, and it's been like, it's been really good. We began online, which I think is amazing because the emerging community leaders, or I'm going to use ECLs, have been able to do so much, even remotely. And now that we're slowly getting back into person, we're going to see a lot of good things coming out. So, and that's what we've been doing. So the ECLs have been trained. They've done their research, their secondary and primary research, and then now they're going to apply what they learned to the community.
So 15 to 20 years ago, we had a press conference with the mayor where we were actually testing whether underage people could buy tobacco products. So either one of you want to dive in? Is it legal to sell cigarettes to somebody who's, say, 14?
Oh yeah, it is illegal, and it should not, children should not be smoking at 14 years old. So that's a huge concern of ours, and we really want to make sure that they don't have access to tobacco products.
So the program we did 20 years ago is we sent in somebody who was underage as a tester, and we had like 7 out of 10 stores were happy to sell them. Does that fit with some of the research that the two of you have been doing?
Yeah, so we kind of did our research differently. Like we just saw that there was it was within close proximity. So we saw that some tobacco retailers, especially in District 3, were less than a mile away from the schools and other areas like where the youth frequent. And then in District 5, we saw that tobacco retailers were close to these schools and other youth sensitive areas within 1 to 2 miles. So it's very concerning to us. And based on our research, we still really want to advocate for the tobacco retail license to be within, like, to limit the distance within 1,000 feet, because we really want to make sure that the tobacco products aren't easily accessible to our youth.
So Councilman Raul Perales, who's from District 3, was on this show 2 months ago and said the city council had a vote coming up on banning vaping and e-cigarettes. Has that happened? Or are we still waiting for it?
We're still waiting for it. And then there was something in the tobacco retail license ordinance that we didn't like, and it was allowing the transference clause to stay. So even though tobacco—
So what's transference clause?
So what it just means is that tobacco retail businesses are still able to transfer their business license to sell tobacco products, and they're able to still remain to the youth sensitive area, so they can still sell tobacco products and youth can still go in and still buy them. And we really want to make sure that goes away. And that's what we really want to push for, is to get rid of that transference clause.
So Swetha, we stepped a little bit on the areas you work in, but talk about it a little bit. This tobacco retail sales sounds like it's right up your alley in terms of what you do. So talk a little bit about what you're doing in the tobacco sales and other areas.
We're mainly like doing research on trying to restrict tobacco sales near youth sensitive areas. Like, that's where our main focus lies.
Well, Deanna mentioned 1,000 feet. Have you actually asked a council member to sponsor a land use restriction? The state law has that on toxics. Nobody's allowed to have a toxics facility within 1,000 feet of a school. So it's pretty clear the two of you'd like to see us get tobacco sales farther away from schools. Have you pitched anything yet?
We did. So we actually visited 2 council members already. Well, we visited council member Perales. Well, we met with his staff. And then we also met with council member Deb Davis from District 6. And they seemed pretty, we weren't sure about their stance, but they seemed to congratulate us and seemed to support the health of youth, of lung health in our youth. So we hope that this would extend over to supporting the ordinance and also getting rid of the tobacco retail, the transference clause in the tobacco retail license.
So who's the council member from District 5?
District 5 is council member Carrasco.
Yeah. So you planning on meeting with her or her staff?
Yes.
Because seems like somebody who'd be pretty sympathetic to this area.
Yeah, so we reached out to her and we're just waiting for an answer back.
So we're going to come back and talk with Deanna and Swetha. We're about halfway through. We're going to take a 30-second break for a public service announcement, and then come back and talk to the two of them more about your health issues in the community. See you in 30 seconds.
My name is Rene Montez. I've been using the CPAP machine, I would guess 10 years. I got so accustomed to it, I don't go anywhere without it. I take it with me everywhere. From the moment I put it on, I thought it was the greatest thing because the breathing was a lot easier, and After using it for a couple nights, I felt a lot of energy. Breathe California is fabulous.
Welcome back. This is Breathe California TV. We have Deanna and Swetha talking to us. They're Breathe California staff members who were working on community action issues. You guys are big talking about a community action model. What's that all about? Either one of you want to run with that?
Yeah, so the community action model is a strategy to like involve communities to advocate for public health improvements. So the CAM model has 5 steps, and step 1 is to recruit and train the emerging community leaders. Then step
Which is you
2,
two hotshots. And there's 5 others of you?
yes, there are. And then
Step
the
2
second,
is,
yeah, step 2 is to define, design, and conduct a community diagnosis, which is the process of finding a root cause of community concern and then discovering a resource to overcome it, and then designing and implementing a community-driven research plan to gather the data on the regarding issue. Then step 3 is to analyze and share the diagnosis. So this is when the team of ECLs will analyze their findings and they'll develop a key message and potentially like change their strategies and then present their findings back to the community members. Then step 4 is to implement an action to address the issue of concern. This includes like doing outreach and demonstrating like a pilot project or and educating the decision makers and key shareholders. Then step 5 is like enforcing and maintaining the action. So after completing the action, we want to make sure that our project efforts are maintained over the long term and they're enforced by the appropriate agencies.
well, it sounds like you're pretty far along. You've had meetings with council members. Are you trying to do something to publicize your findings, like writing a guest editorial in the Mercury or maybe appearing on a community TV show?
I mean, that's what we're trying to do. We're here with you. We're hoping to write letters. We're also trying to do a little social media post and just share within our prospective networks. So we're hoping that we get like our issue out, and hopefully the community members would be motivated to take action.
So that's my phone, just ignore it. So we have 5 or 6 assembly members and maybe 3 state senate members. Have you thought about going to them? For example, the restriction on toxic facilities near schools is a state law. And basically starting in December, which is the start of the legislative cycle, it's a good time to get ideas to them. They have to have it done by February. Either of you want to comment on that?
So we were just thinking of just focusing on the local level, just because we don't want to wait for the state. Anything can happen, just like how we saw that the hearing in the flavored tobacco products got pushed. So yeah, and that's why we just wanted to focus within our own communities in San Jose.
Do you have any intention to broaden this beyond San Jose to spots like Campbell? Or are you just going to stay inside of San Jose, you think?
I think for now, just inside San Jose. If there's an opportunity to do Campbell, we would love to do it. But just right now, only within districts 3 and 5 of San Jose.
Well, I appreciate you giving me your community action model. I have a speech that they've entitled that I'm doing on Thursday afternoon, which is how to make a difference. And it seems to me like this is a good model to try to work in for all of that. So Swetha, have you been given testimony at city councils on this?
I haven't got the chance to, but hopefully I can on the September 28th hearing. And also, we're meeting another council member soon, so hopefully then as well.
So the 28th is the hearing on the vaping and e-cigarettes?
It's
What is the council hearing then?
the 28th is for the restricting the tobacco sales near schools.
Oh, good. So what makes this project different and why is that important? Yana?
Yeah, so this project is different from others because we're actually like focusing on community members. We invite them in to talk about the issues that they see and what they want changed. You can community participatory, and that's what we want to do, and to empower community members to really say, hey, like I can make a difference, rather than just thinking like, no, like I'll just let others handle it. Like, no, I really want everyone to know that even through this community action models, to realize like you really can make a difference by doing everything you can, and you can do whatever you can to make things happen and make real change, real lasting change in your communities.
Well, that's very significant because people are prone to be overwhelmed by the society of a country with 330 million. But my experience is local and state officials are very responsive to people talking to them. So talk maybe Swetha on your research findings. You mentioned that the city seemed to be fairly light on trying to control this public health problem of smoking. What other findings did you have?
Yeah, so we found that the San Jose tobacco zoning laws are pretty minimal, and that nicotine dependency can harm adolescent brains that can alter their students' learning and attention and mood. And we found that a lot of the youth sensitive areas are like public parks, plazas, and convenience stores, and that public health officials, youth leaders, and some of the city council members are supportive of our tobacco restrictive sales.
I'm surprised it's not every one of them, but I'm sure there's some people that think anybody ought to be able to do anything that they can, and it was just freedom of choice. So more specifically, Deanna, you had some observation on stores.
Yeah, so we have pretty interesting data from our store observations. So how we did this store observations first was that we looked at a map of District 3 and 5 of San Jose. And we just saw like, okay, like this is the areas that we should observe because there's a lot of tobacco retailers, and we just went and did little observations of that. And what we found was pretty interesting. So we in District 3, we saw that 80% of the tobacco retailers were located less than a mile away from a school. And then in District 5, we saw that 63% of the tobacco retailers were located within 1 to 2 miles of the school. And then for District 3, we saw that the most common products, tobacco products, were dissolvable products, which accounted for 55.6% of it.
So explain what a dissolvable product is to me. Not being a user of tobacco products, I'm a little clueless on that.
Yeah, so dissolvable products are, just think of them as vapes. I remember like I think it's just those little things where you can just take a hit and or like take a little puff and then you're able to just throw it away as soon as it's done.
Okay. Anything more on the research you did on the stores?
Yeah, and also for District 5, we saw that one of the most common tobacco products were actually cigars, little cigars and cigarillos. And there is 66.7% of that. And then there's a lot of other products too. So we saw that cigarettes came in at second at 63.3%, and then e-cigarettes at 57.1%. And traditional smokeless tobacco products were also common at we saw like 55 or 54.1%. And then water pipes they were like sold and accounted for 53.3%.
So Swetha, you did some, you have some results that are broader surveys, public discussions. What happened there?
Yeah, so we did surveys and like interviews that were conducted by emailing them and like asking like parents and teachers and students and also like neighborhood associations on like what they thought about tobacco. And they found that most of the 82.17% of the adult respondents found that they were in favor of implementing a law that would prevent stores near schools from selling the tobacco related products.
So I apologize, but we're about out of time. I'm getting a signal from our director to wrap up. Deanna Swetha, I appreciate you joining us today. Smoking remains a problem, even though we've seen steps taken to reduce its use, and we appreciate your efforts to do something. So for our audience, hope to see you next week. Thanks again.